Good day, everyone. So today we're going to discuss about the problems during the first, second, and third trimester of pregnancy, which is the premature cervical dilatation. First, we have to review the um, the reproductive system of a female. We all know that this has parts: the right fallopian tube, the left fallopian tube, the right and left ovaries, the uterus, the endometrium, the cervix, the vagina, and the vulva. And to visualize it clearly, this is once again the fallopian tube, the ovary, the uterus, the cervix, and the vaginal canal. And this is an actual picture of a female cervix. In female reproductive system, the cervix is the lower end of the uterus. This is once again the cervix. And it opens into the vagina. Before pregnancy, the cervix becomes soft, short, and it dilates or it opens so that the mother can give birth. And next, what is premature cervical dilatation or cervical insufficiency, or today it is called as incompetent cervix? According to the American College of Obstetrician Gynecologists, or the ACOG, this is due to the inability of the uterine cervix to retain pregnancy in the second trimester in the absence of uterine contractions. This incompetent cervix can cause problems such as miscarriage and premature birth. Cervical insufficiency occurs when the cervix opens too early and silently during the pregnancy. And for the objectives, the general objective is to be able to provide an important discussions with regard to incompetent cervix through a video presentation. Specific objectives are to know the definition of incompetent cervix, to learn the treatment medically that usually works in an incompetent cervix, to learn signs of premature cervical dilatations, to be able to discuss the nursing management and care with an incompetent cervix, to review the causes of cervical incompetence, and to discuss the pathophysiologic events in details. And the key terms. Cervical cerclage, it refers to a variety of procedures that use sutures or synthetic tape to reinforce the cervix during pregnancy in women with a history of a short cervix. It can be done through the vagina, the transvaginal cervical cerclage, or less commonly through the abdomen or the transabdominal cervical cerclage. Miscarriage. Miscarriage is when an embryo or fetus dies before the 20th week of pregnancy. Miscarriage usually happens early in your pregnancy. Premature cervical dilatation. It refers to a cervix that dilates prematurely and therefore cannot retain a fetus until term. Prophylaxis. Measures designed to preserve health and prevent the spread of disease. The protective or preventive treatment. Sherrod-Carr suture, also called as McDonald cerclage, is a porous string stitch put into the cervix mouth of the womb to keep it tightly closed during pregnancy. And transabdominal cervical cerclage. It is a procedure where a gynecologic surgeon makes an incision in the lower abdomen near the bikini line. Through this transabdominal incision, the surgeon places a small woven synthetic band high on the cervix. The band supports the cervix. preventing it from opening and losing the pregnancy. Transvaginal cervical cerclage. There is no surgical incision. The doctor sews the cervix shut with a suture placed through the vagina, and usually during the 13th or 14th week of pregnancy. And this method creates a porous string round the cervix, which helps reduce the risk of pregnancy loss. At about 37 weeks, the doctor removes the stitches so that a vaginal delivery is possible. Trendelenburg. Berg. It is a position for patient on the operating table, most commonly used during lower abdominal surgeries and central venous catheter placement. And next is the types of cervical insufficiency. So there are two types of cervical insufficiency: the congenital cervical insufficiency and the acquired cervical insufficiency. Congenital cervical insufficiency is the defects in the embryological development of Mullerian ducts. And this is a picture of Mullerian ducts. Um, The Mullerian ducts are an essential aspect of the development of the urogenital system. Initially, they are present in both sexes, but it regressed under the influence of anti-Mullerian hormone or AMH. This hormone is produced by the testes and serves to seize the development of female internal organs. Without the influence of AMH, the ducts develop into the uterus, the uterine tubes, the cervix, and the upper one-third of the vagina, comprising some of the female internal genitalia. And the function of these structures is the site of fertilization and to transfer and support the egg throughout the development. And the second type is the acquired cervical insufficiency, and it may be because of trauma. Um, Trauma such as cervical laceration during childbirth, cervical conization, lip or loop electrosurgical excision procedure, or forced cervical dilatation during the uterine evacuation in the first or second trimester of pregnancy. And let's go back to the cervical conization. Conization of the cervix, or cold knife cone, or CKC, is a surgical procedure used to treat or diagnose cervical dysplasia. It is the excision of a cone-shaped portion of the cervix to remove a cervical lesion and the entire transformation zone. Practitioners can use this when there are a conflicting pap smear and biopsy specimen. Cold knife can lead to cervical insufficiency as one of this procedure's complications. And next is the incidence. The epidemiologic studies suggest an approximate incidence of 0.5% in the general obstetric population and 8% in women with a history of previous mid-trimester miscarriages. Wide variation in the incidence of cervical incompetence has been reported, which is likely due to real biologic differences among the study population, the criteria used to establish the diagnosis, and reporting a bias between general practitioner and referral centers. And for the causes, first is the increased pelvic pressure due to increased fetal weight, cervical insufficiency, pelvic insufficiency, and risk factors and predisposing factors. The cervical trauma, race, congenital conditions, increased maternal age, and congenital structure defects. Cervical trauma, um, it is due to some surgeries like uh, surgical procedures used to treat cervical abnormalities associated with an abnormal pap smear can result in cervical insufficiency. Other surgical procedures, such as a DNC, could also be associated with cervical insufficiency, and rarely a cervical tear during a previous labor and delivery could be associated with an incompetent cervix. And for the race, Black women seem to have a higher risk of developing cervical insufficiency, and until now, it isn't clear why. In congenital conditions, uterine abnormalities and congenital disorders affecting a fibrous type of protein that makes up your body connective tissues or the collagen might cause an incompetent cervix. Exposure to DES and synthetic DES is a synthetic form of a hormone estrogen before birth also has been linked to cervical insufficiency and increased congenital structure defects, such as abnormally formed uterus or cervix and a short cervix. Next is the prognosis. Currently, the prognosis for successful pregnancy after surgical correction for premature cervical dilatation is very favorable. The success rate with both types of cerclage techniques average 80% to 90%. And for the complications, rupture of the uterus, internal bleeding, laceration on the cervix, infection, premature birth, pregnancy loss. Also, this is a picture of a rupture of the uterus. You can see in the anterior uterine wall, there is a tear, and the blood is flowing into the abdomen. And next, the assessment. First, ask the woman who is reporting for painless bleeding if she is feeling an intense pressure on her pelvis. Inspect and save pads used by the woman during bleeding to determine any clots or tissues that already passed out. Determine if the woman is experiencing true contractions to prepare for birth of the fetus. Next is the nursing diagnosis. Anxiety related to impending loss of pregnancy as evidenced by premature dilatation of the cervix, abruptio placentae, fetal growth restriction, multifetal pregnancy, preeclampsia, premature rupture of membranes, and preterm labor. Next is the pathophysiology. Uh, The competent human cervix is a complex organ that undergoes an extensive changes throughout gestation and parturition. A complex remodeling process of the cervix occurs during gestation, involving timed biochemical cascades, interactions between the extracellular and cellular compartments, and cervical stromal infiltration by inflammatory cells. And any disarrays such as risk factors, and these are the risk factors for a cervical insufficiency. These are the risk factors which defects in the embryological development of Mullerian ducts, Marfan syndrome due to the deficiency in collagen, um, abnormal development, race, increased maternal age, congenital structure defects, or a abnormally formed uterus or cervix, a short cervix, and trauma to the cervix, which are previous cervix surgery, damage to the uterus from previous miscarriage or childbirth, exposure to DES. DES is a synthetic human-made hormone given to some women in the past to help them have a successful pregnancies. And for the contributing factors, these are the contributing factors. The cervical laceration during childbirth, cervical conization, lip or loop electrosurgical excision procedure, or forced cervical dilatation during the uterine evacuation in the first or second trimester. And the causes for this is it. The causes for this are increased pelvic pressure due to increased fetal weight, cervical insufficiency, and pelvic insufficiency. All of this will happen after the sexual intercourse when the sperm and egg meets, and implantation will follow. At 20th week, the fetus will gain weight and fat, and because the mother has this uh, cervical insufficiency or incompetent cervix, the symptom will be a show, which is a pink tinged vaginal discharge, followed by a rupture of the membranes and a discharge of amniotic fluid. And uterine contraction will begin, and um after a short labor, the fetus will born. And for the therapeutic management. So there are three types of therapeutic management: the McDonald cervical cerclage, Sherrodcar cervical cerclage, and transabdominal cerclage procedure. The McDonald cervical cerclage, um, nylon sutures are placed horizontally and vertically across the cervix. They are pulled back together until until the cervical canal is only a few millimeters in diameter. And Sherrodcar cervical cerclage, a sterile tape is used for this technique, where it is threaded in a porous string manner under the submucous layer of the cervix. Then it is sutured in place so it would close the cervix. Transabdominal cerclage procedure. An incision is made in the lower abdomen near the bikini line. Through this transabdominal incision, a small woven synthetic band high on the cervix is placed. The band supports the cervix, preventing it from opening and losing the pregnancy. Blood flow from uterine artery remains unaffected. And this is a a picture for you to picture out those therapeutic management. This is where the transabdominal cerclage is placed, the Sherrod-Carr cerclage, and the McDonald cerclage. McDonald cerclage is the in the lowest portion. And next is the nursing management. First, determine any factors that further contribute to the anxiety of the woman so it could be avoided. Monitor vital signs to determine any physical responses of the patient that could affect her condition. Convey empathy and establish a therapeutic relationship to encourage client to express her feelings. Provide an accurate information about the situation to help client back into reality. Assess the level of client's knowledge about pregnancy to determine what the client still must learn. Conduct a home visit. Assess if the mother knows about body temperature and ask if she has a thermometer at home to know if the mother will be able to monitor its temperature. Encourage significant others to show their support to the mother to help the mother cope with the situation. And these are the references. Thank you so much for listening. I hope you've learned something and enjoy your day.